Imagine a sudden, unexpected change in your body. One side of your face droops, an arm feels weak, or your speech becomes slurred. These are classic signs of a stroke, a medical emergency where every second truly counts. What happens if you hesitate or decide to drive yourself or a loved one to the hospital instead of calling emergency services? If you do not call 911 for stroke symptoms, you risk delaying critical, time-sensitive medical interventions that could save brain function and significantly improve recovery outcomes. Immediate access to emergency medical care is paramount because the brain is highly vulnerable during a stroke, and treatments are most effective within a very narrow time frame. The core reason for this urgency is that during an ischemic stroke, which accounts for about 87% of all strokes, a blood clot blocks blood flow to part of the brain. Without blood, brain cells are deprived of oxygen and nutrients, and they begin to die rapidly, roughly 1.9 million cells per minute. Treatments like tissue plasminogen activator, known as TPA, a clot-busting medication, or mechanical thrombectomy, which removes large clots, must be administered within a few hours of symptom onset to be effective and safe. Waiting can make these life-saving options no longer valuable. Therefore, the moment you suspect a stroke, it is crucial to call 911 right away. Do not attempt to drive yourself or someone else to the hospital. Emergency medical service personnel are trained to recognize stroke symptoms, stabilize the patient, and, most importantly, transport them to the nearest appropriate stroke-ready hospital, which has the specialized equipment and staff to begin treatment immediately. Providing a clear description of the symptoms and when they started to the emergency operator is also incredibly helpful. Calling 911 also activates a rapid response system. This system ensures that when the ambulance arrives at the hospital, a stroke team is already prepared and waiting, minimizing delays in diagnosis and treatment. This coordinated approach often bypasses typical emergency room waiting times, ensuring that precious minutes are not lost. These specialized stroke centers can offer advanced imaging and interventions, which are not available at all medical facilities. Ultimately, choosing not to call 911 when stroke symptoms appear can lead to more severe and lasting brain damage, greater disability, and a longer, more challenging recovery journey. Acting quickly by calling emergency services is the single most important step you can take to protect brain function and give yourself or your loved one the best possible chance for a positive outcome and return to a full life.